September is Ovarian Cancer Awareness Month, and the St. Louis Ovarian Cancer Awareness Group looks to educate and support local women and their families dealing with this disease. Susan, the founder of SLOCA, joins us live in studio this morning. First of all, great to see you.
Thanks.
It's been
Thanks for having me,
a few
Rennie.
weeks since the last time we saw you. We always talk about awareness when it comes to diseases. How vital is awareness to ovarian cancer when it comes to life and death?
It's really important, as really it is with any disease, but with ovarian cancer, it's so sneaky. And the symptoms are so, they're kind of something women might experience on a normal basis. Feeling bloated, a little pelvic or abdominal pain, feeling full quickly, and those could be very benign, and often they are, but if they become chronic and really get a little bit worse, you've really got to bring it up to your healthcare professional.
Now, when you look at age groups, is this something that older women should be aware of? Younger women, in between? I mean, at what point do you go, something's not right?
Great question. Really, the age range is pretty wide. I was 23 when I was diagnosed. Wow. And of course, that is not on a radar of a 23-year-old or my healthcare professional, to be honest with you. And it was so many years ago, there wasn't even Google. I couldn't Google my symptoms. I had them for months and months, and I was dismissed as, you know, GI issue or, oh, you'll be fine. And I just lived my life until I could no longer bear the pain. And the bloating was just so terrible. I was discovered in surgery. Wow. And you just don't want that to happen if that can be avoided.
Having gone through the journey, how passionate are you about SLOCA?
Well, it's just been a privilege to be the executive director of this organization for 10 years. I'm so passionate because women need to know the signs and symptoms, and they need to know that if they have their annual exam, there is not a screening test or a diagnostic test for ovarian cancer, so that you're not even covered in that regard. So you've just got to know your family history. Is there breast cancer, ovarian cancer, colon cancer in your family? Is there a hereditary risk that you need to be aware of? And let your doctor know that. But SLOCA is here to raise awareness and also support survivors through the journey.
Yes, that's what I wanted to ask you, because you know, I've gone over to SLOCA. I've done the event a few times. What are the services you guys provide?
So part of our mission is to support survivors. So the journey begins with really your first diagnosis, your chemo treatment. And we deliver chemo care packages called sister boxes to all newly diagnosed women when they're at their first infusion. And that is a day that, you know, they need some comfort. And these are comfort items. It's really just something to let them know we're here. There's an organization here with a sole focus to support you through this journey. And then they become aware of the other services that we have. We have a patient need fund for women who are underserved and need some financial support, a mentor program if you need someone to talk to who's been through the journey to provide emotional support. But then we also bring survivors together for events and camaraderie, and they need a network. They need to be around other survivors and talk about their journey and how it compares, and just know and have hope.
I wanted to ask you that, having gone through this, do the other women who begin their journey, do they come to you and talk to you personally because they know you've been there?
They do. And it's so humbling for me because I 42 years, no evidence of disease.
Wow.
And so many of the women, I know that their struggle might be different and their journey might be different, and they might have a recurrence in 1 to 2, 3 years. And I understand the shoes that they're walking in, but I am one of the lucky ones. But I can really be empathetic and listen and care about everyone.
I know you appreciate life, you know, having been around you. I know how much you appreciate life. If someone is looking for support, looking to learn more, where should they go to learn more about SLOCA?
SLOCA.org, SLOCA.org, and please, we have a run coming up. We have a lot of ways for the community to be involved and support others going through this journey.
It really is a community. It's not just the women going through this, it's also the entire family. So that support system is so vital.
It is, and we're here for the women who need us.
Well, thank you so much.
Great
to see you too.
You too.
All right, you be good.
You're a good friend to SLOCA. Thank you, Rennie.
I do my best. Thank you very much.